Hey, it's Paul Thomas with Total Country Bob FM, sitting here with Dr. Mark Lobanoff from North Suburban Eye Specialists. We were just talking about how the misconceptions in the marketplace, if you will, about, blades and this and that. I mean, it's 2014. You run an all laser setup with the best in the business. Let's talk about that technology, first of all, as it stands here in your clinic, and also maybe some of those misconceptions that were the advancements that we've had in the last 5-10 years.
That's right. So we talked a little bit about the concept that we use a blade to create the flap for LASIK. That's really old technology, and most centers will use all laser LASIK.
Okay.
But that doesn't mean all lasers are created equal. And if you think about how far technology's come, if you look at a cell phone from 2004,
okay,
you compare that phone to a 2014 version, yes.
It doesn't flip anymore.
Well, it doesn't flip. They both can make a phone call, but boy, so many more features built into the most advanced, the latest design.
Correct.
The same is true with these lasers. They keep getting better, and we have the latest version of the lasers in the world, and most centers don't. Most centers are making do with 8-10-year-old lasers.
Wow.
So it's important to know that all laser LASIK doesn't describe everything. It's how good are those lasers now. So
Okay.
we keep raising that bar. And because the technology keeps getting better, a lot of the misconceptions, we can't treat astigmatism, or we can't treat eyes that are a little bit thinner, or you can't correct the vision so people can get free of reading glasses. All those misconceptions are really not true with the latest technology.
So it's possible then that if I maybe had a consultation 10 years ago and I said, yeah, unfortunately we're sorry you don't have, you're not a candidate for LASIK,
Right.
Technically that could be not true today.
In fact, in most cases. And it's amazing how many people come in and they say, I was told before I couldn't have LASIK. I'm not really expecting you to say yes. And we analyze the patient, we go through the exam, and we say, you're a good candidate. With the new technology, you're going to have an excellent outcome.
Awesome. And talk to me about the technology. You shared with me at one point in time how accurate these lasers are. And again, my radio persona, it was fractions of a fraction that I was not able to understand here. So could you help me maybe in layman's terms figure out how unbelievably exact we're talking here?
Well, put it this way, your hair is about 10 microns thick.
Okay, my hair or the human hair?
Human hair.
Okay, we're not talking about my hair, sir.
That's
Okay,
true.
thank you very much. We're not going to get into that topic.
So the average human hair, about 10 microns thick. This laser cuts down to a single micron. So the amount of precision that's in this is just incredible, and the speed is so fast. So one of our lasers fires every millionth of a billionth of a second. It's a little hard to kind of wrap your head around that, but think of how small a unit of time that is, a millionth of a billionth of a second. And so the precision, the speed of these instruments is it's unparalleled. There's nothing else like it in all of medicine.
That's unbelievable, and that shows, because we've been talking about this, what's crazy about the procedure itself is, I'm going in to have LASIK surgery, right? It's a less than 10-minute procedure. It was like, I think I was in the chair for 3 minutes maybe? I don't even know.
Exactly.
What is the typical average time?
The average amount of time from the moment you walk into the room to the moment you're walking out of the room is about 7 minutes.
It's unreal.
And the amount of laser time is actually probably about 5 to 6 seconds.
Yeah. So you talk about that, and I think again that's a misconception. People are maybe saying, I got it's a big procedure. It's not a time-consuming thing for you. You can see right off the bat, it's phenomenal. Maybe do you want to talk real briefly about the actual procedure itself? Like what are you actually doing? You talked about the flap and then the laser. Are you keeping me awake during the procedure? Are you is there local anesthesia? Talk to me about that a little bit.
Okay, so one of the important things to know about it, people say, oh my gosh, I don't know if I could go through that. I'd be too scared. But we give all of our patients Valium. And Valium's a drug that just helps you relax.
Yep.
Give you as much as you need, give it time to take effect. So you walk into that room, you're already feeling relaxed,
Yes.
chilled out.
Yep.
Then we numb up the eye. So we use eye drops to numb up the eye so you're not going to feel any pain. Once you're within that room, the cornea is the clear dome of tissue on the front of the eye. We simply use the first laser to make a very precise flap. Lift the flap up, a second laser comes down, painlessly takes away a little tissue, reshapes it within 5 seconds. We put the flap back into position, we sit you upright, and you can't feel anything, you can suddenly see around the room and you're ready to go.
It's unbelievable.
You know, a lot of patients will say, well, what if, can I mess this up? I'm worried I'm going to look away at the wrong point in time, or do I have to hold my eyes open? We really take you out of the equation. The new technology, the new lasers have tracking systems. So it's watching for eye movement. And if your eye moves, so does the treatment. If the eye moves too far, the treatment won't fire.
Yeah.
So there's safety features built in so that you can't mess this up.
Yeah, you're not worried that I'm going to do something, like I can't keep my eyes steady or something
Exactly.
like that.
What if I looked away?
Yeah.
You don't have to worry about that. We have taken care of those things for you.
That's awesome. And there's a video that you have this whole process that you can see it. All you got to do is schedule your consultation with Dr. Mark Lobanoff here at North Suburban Eye Specialists, 763-421-EYES. Give him a call today and change your life forever.